Hello, beautiful people. Welcome to another episode of MedReview. God, I've missed this. Today I'm with this very special guest. I'd like her to introduce herself a bit later. We are going to review the TV series called The Midwife. Can you say hi for everybody, please?
Hello, everybody.
Oh, wow, that's nice. Alright, so without further much ado, let's watch our first clip. Okay. She looks pregnant, very pregnant, and what's happening in there?
So right now we can see the midwife is palpating the abdomen.
Wait. Before you go further, what's that
Yes.
she's holding?
She's actually holding a pinard,
Okay.
which
Okay.
is quite an old school equipment. It's used to listen to the fetal heart.
Okay.
It's something I often give to my student midwives because it's quite good to find the fetal heart with that machine. But now we use something called a sonic aid, which is much easier to use. So yeah.
Okay, so break it down for us.
So what it seems, it looks like an antenatal assessment.
Okay.
So this is something that women often go to during their pregnancy.
Okay.
It's quite important to go to each appointment, and there's quite a few things that we do at those appointments, but listening to the baby's heart rate, one of those.
Okay,
things
so
that we do.
like averagely, how many appointments do you need to go to for a single pregnancy?
Good question. So you have about, the first is your booking appointment, then
Okay.
you'll probably have a 16-week appointment, a 28-week appointment, a 32-week appointment, a 34, 36,
Oh, wow,
38,
wow.
and 40 week.
Wow.
That's about most likely 8 appointments, and that's not including your scans and
Okay.
other consultant appointments that you may have,
Yeah.
or other additional appointments you may have as well.
So during those appointments, what really is done? We've seen palpation of the abdomen. We've seen listening to the fetal heart. What else?
Good question. So during your appointment, the first thing that will happen, obviously, you'll be greeted by your midwife and maybe other healthcare professionals, student midwife. The first thing they may do is ask how you're doing. They will do a blood pressure,
Okay.
check your urine as well. They would also, they may check your pulse, and they would also ask your permission to palpate the abdomen and then listen to baby's heart rate. They would also do a fundal height check.
Okay.
Now, with this, years ago, we used to do it based on your gestation, so how many weeks you were.
Okay, so just in case somebody doesn't know what a fundal height check is, can you
Yes.
just break down?
Good question. This is basically where we measure from the symphysis pubis all the way up to the upper part of your abdomen.
Okay.
Checking.
where the pregnancy.
Yes,
Kinda like
yeah. We're checking, so what we do, we palpate to feel for the hardest part and the softest part.
Okay.
So in between that line, we use a measuring tape to check the fundal height. Now, what most hospitals have now is a growth chart.
Oh, okay.
Now, it's personalized to each woman, whereby they look at her height, her weight, so her BMI, and they look at past pregnancies, and the baby's weights, and also her ethnicity.
Okay,
as
so
well.
currently it's not just tailored only to her gestational age. There are other factors though, so that
Yes.
excellent.
And
Excellent.
what we found from these personalized growth charts, we can identify babies that are small, babies that are big, just by that. So it's quite a good technique.
Wow, that's deep, man. That's deep. Okay, let's check out what our next clip has. This is. I don't know how ladies go through this, but from her facial expression, it doesn't look good at all. Ooh.
Yeah.
Okay, it's getting a tad bloody. Okay. Oh, that's a beautiful baby.
It is.
Ooh. I don't know where to start with this one.
Okay.
But basically, we saw a lady give birth,
Yeah.
and any movie, any series you watch, it's always the most dramatic thing you can imagine. What can you tell us about labor?
So with labor, ideally we want you to go into labor after 37 weeks.
Okay.
Okay, that's what we identify as full term.
Okay.
And established labor is basically commenced from when you're 4 centimeters dilated.
Okay.
And you're having regular contractions.
Okay.
Now, that's not to say that if you're having contractions and they're not regular and you're not 4 centimeters, you're not in labor. There are a few stages of labor. So the first stage will be the latent phase.
Okay.
So this is where most likely you're at home, you've had some irregular contractions here and there, you've gone to the hospital to get checked out, and they've told you you're just 2 centimeters, please come back later. And it may be disheartening for some women, but that's like the start of something great. So that's the latent phase. It takes a while, and then when you get to the first stage of labor, that's when you're 4 centimeters dilated. It's what the NICE guidelines have identified as being an established labor.
Okay.
And ideally we want you to progress from 4 centimeters to 10 centimeters. Okay. Now, the next stage will be the second stage of labor, where obviously we deliver the baby and the head, and the third stage is the placenta delivery.
Okay. I've heard this quite a lot. Braxton Hicks. Is that latent phase?
Yeah, so it may not even be the latent phase.
Exactly.
Some women experience it earlier on in their pregnancy, and it shouldn't be painful. It's more uncomfortable.
Exactly.
Where your abdomen goes hard and it softens. And it's, I always tell women, it's like just showing you what it may feel like.
Yeah, kind of like a trailer to the main
movie. Exactly.
Wow. That's something. So can you tell us some complications that occur during labor?
Good question. So sometimes in labor, the baby's heart rate can decelerate.
Okay.
And the normal heartbeat for us is from 110 beats per minute to 160 beats per minute.
That's for fetus.
For the fetus, yeah. For
my,
the adults,
my heartbeat is that.
That's too fast
that's
for
too
us.
fast for us.
So if we identify that it's going below that amount for more than 3 minutes, for example, we tend to think, okay, what can we do to speed up delivery and get this baby out safely? Okay. So sometimes we may have to perform an instrumental delivery. Okay. If you're close to, delivering, we may have to perform a episiotomy like we saw in the video. Okay. And then a doctor may be called in to do some extra maneuvers to help bring baby out, either by ventouse or forceps. There are often times where we have to do a cesarean section if, for example, either mother or baby is compromised. Sometimes if the mother is bleeding, she's having an abruption, for example, where the placenta is separating from the uterus, we may have to do an emergency cesarean section. There are so many different types of complications that can arise, things like a dystocia.
Exactly.
Dystocia.
That's, can you break it down for us?
So in simple terms, it's basically when the head advances and it's out, and then the shoulders are stuck. Okay. So we have to do internal maneuvers to help bring the shoulders and the body out. Now, ideally, we don't want baby's head out for too long. So we do different maneuvers. We'll probably lay you flat, try and do McRoberts maneuvers. It's all names and terms you may not understand.
Let's see what our next clip takes us to. Okay. Can you just, as brief as possible, run us through pregnancy? I know it's something really huge, but I don't know how you can break that down for us.
So I would say pregnancy and the process is so beautiful. It changes your body and your mindset.
Exactly.
Most times positively. There are different types of pregnancies as well. You see women who will come in and they're having twins. Wow. I've seen triplets as well. Wow. There's surrogacy.
IVF.
There's IVF.
Yeah.
There's so many methods.
So what do
pregnancy.
Ladies normally experience in their bodies when they're pregnant?
Okay, so the first thing you'll probably experience, some women have it, some people don't. Is morning sickness.
That's when you feel like nauseous.
Yes, nauseous. So all the hormones in your body are changing. Some women also experience cramping pains, and this is something no one really tells you about. So especially when your abdomen is growing and the baby's growing, the placenta is also growing, you may feel cramp or growing pains, they say, where your bump starts to get bigger and bigger. Some women also have, for example, have swelling from pregnancy in their hand and their feet, which can be normal. However, if it's constant, it can be water retention, and it can also be an issue with your blood pressure. So that's something to check out as well.
Wow, that's a lot. I know, talking about pregnancy will definitely link to labor. We just had a session on that where you did talk about some of its complications. This lady seems to be having meconium stain like her, and there's a lot to talk about when it comes to complications during pregnancy. You said something about swelling, right? It brings in mind preeclampsia, eclampsia. Can you just run us through it?
So one thing I must add, pregnancy really highlights underlying issues or things that you may potentially have in the future. So for example, women who have gestational diabetes or hypertension in pregnancy are more likely to have it later on in life. So it's almost like your body's telling you
kind of like
fix up before
it's just around the corner,
exactly. So preeclampsia is basically, in a nutshell, high blood pressure with protein in your urine, with other symptoms such as swelling and sometimes epigastric pain. So most times this is identified through blood tests and constant blood pressure checks and profiles. And the thing is, if it goes untreated, the placenta sometimes can stop working effectively. Baby may also stop growing, in utero. So it's something we have to keep an eye on. And most times women are on medication for it, or we may have to bring the delivery forward. Because again, like I was saying, most of these diseases, once you've had the baby, it disappears. Kind of like, literally,
they say the cure for preeclampsia or eclampsia is just to get the placenta out.
That's it.
Basically it solves everything. We've just talked about some complications of pregnancy, and having complications normally divert delivery from being vaginal to the use of assisted delivery, as you said earlier on. Cesarean section, CS. Can you tell us why we need not to fear about getting a CS, and can you even tell us what a CS is?
So a cesarean section is basically an incision, literally near the bikini line. You go through the skin and then the uterus, and then you get baby out, and most times it's the last result. And it's always by a trained obstetrician. So please do not fear if you have to get it done. And I know sometimes it can be a bit frightening because we're in the room and everyone's rushing around. But the aim is to get you and baby fine and safe. And what we do then, again, the surgeon will then stitch everything back up like it was before, and you'll have some pain relief afterwards. But most times women will have a cesarean section if they've previously had cesarean sections before, and they've opted for one. If they've have certain conditions where they think, this would be better for me to have a cesarean section. If baby is compromised, or if there's severe bleeding, if, for example, you've had an induction of labour and it hasn't worked effectively, that may be the next step. So it's not routinely done. We would prefer to have a vaginal delivery, but if we can't, that's the next option.
Like, I've got lots of questions for you. Like, I have lots of questions for you, and I just love the way you just coming up with the answers. Like, it's just like that. It's like nothing to you, man. I have to stop now because I think I'll let you just introduce yourself and tell us why you know all these things.
Brilliant. Okay, so hi everyone. My name is Jade Solo.
Hi, Jade.
And I am a diabetic specialist midwife. I've been working in the NHS for over 4 years, and I work in a southwest London busy hospital.
I can imagine that. What else do you do apart from just going to work?
So I'm also an antenatal teacher.
Oh, okay.
On the side, and I have a platform called All Births.
All Births.
Yes.
Okay.
You can find us on Instagram, and what we do is share information, fun tips on everything pregnancy related, And we also do one-to-one antenatal classes in the comfort of your own home, just to share some information that you may not always get time to when you're at your antenatal appointments.
Oh, okay. So she's introduced herself. Her name is Jadisola. I'm Dr. Abe as always, and it's been a pleasure having you with us. I'll leave her details up on screen. Please do follow her, and she has lots more to share with everybody. Till we meet in our next episode. See you later.
Bye.